Did you know that after the age of 60, more than 70% of men experience erectile dysfunction or premature ejaculation? And one of the silent culprits is not disease, not medication, but the very way you masturbate. Many men still hold on to habits from their 20s, fast, intense, rushed. But at age 60, the body has changed. Your testosterone may drop by as much as 30 to 40% compared to your younger years. Your pelvic blood vessels have narrowed, and your nerve sensitivity has declined significantly. If you continue with the old habits, you are weakening your ability to achieve a natural erection, driving testosterone even lower, and losing control over your orgasm. But the good news is that with just a few simple adjustments, masturbation can become a form of natural therapy, a way to boost testosterone, improve blood circulation, reduce the risk of prostate cancer, and maintain your male vitality after 60. In this video, I, Dr. Emily Carter, a men's health specialist with over 20 years of experience in the United States, will show you 7 healthy, science-based, and age-appropriate ways to masturbate after 60. And I want to hear from you. Do you believe masturbation after 60 is helpful or harmful? Leave your comment below, because your answer may help many men of your generation understand the truth behind this habit. To understand why masturbation techniques need to change after 60, we must start with the biological transformations inside the male body. First, testosterone, the hormone most associated with male strength, declines by an average of 1% every year starting at age 30. By the time you reach 60, your testosterone level may be 30 to 40% lower than in your youth. This not only reduces libido, but also directly affects your erectile function, muscle mass, and overall male confidence. Next comes the vascular system. According to the American Heart Association, around 30 to 50% of men over 60 experience narrowing of the pelvic and penile arteries due to atherosclerosis. When blood flow is reduced, the penis cannot fully engorge, resulting in weaker or shorter erections. We also cannot ignore the sensory nervous system. A study published in the Journal of Sexual Medicine, 2015, revealed that penile sensitivity decreases by 20 to 25% in men over 60. This means that the same stimulation that once triggered orgasm now requires more intensity and more time to achieve climax. In addition, the pelvic floor muscles, critical for controlling ejaculation, weaken progressively with age. According to Harvard Health, pelvic floor strength declines by 2 to 3% each year after 60, making it more difficult for many men to maintain erections or control the timing of ejaculation. Finally, changes in the brain and neurohormones also alter sexual experience. Dopamine and endorphins are released in smaller amounts, leading to less intense orgasms, while cortisol, the stress hormone, tends to rise. All of these factors compound, and if you continue using the same old masturbation techniques, you may unintentionally worsen erectile dysfunction, premature ejaculation, and further testosterone decline. This is exactly why men over 60 need healthier, science-backed, and age-appropriate masturbation practices to turn this activity into a natural therapy that restores sexual health and preserves vitality. To build a healthier and more suitable masturbation technique, gentlemen should follow these steps. 1. Reasonable frequency. Many men think that the more often, the better, like exercising. But medical reality says otherwise. After age 60, the male body needs a balanced rhythm to maintain testosterone while avoiding fatigue. A 2016 study in European Urology found that men who ejaculated regularly 2 to 3 times per week reduced their risk of prostate cancer by up to 20% compared with those who ejaculated less frequently. At the same time, this frequency is sufficient to maintain pelvic blood flow, reducing blood stasis and prostatitis, 2 issues commonly seen after 60. Conversely, masturbating too often, say 4 or 5 times a week, can leave you fatigued, lower libido, and create dopamine dependency that blunts orgasm intensity. Too infrequently, such as only once a month, means pelvic blood flow is not maintained. Pelvic floor muscles weaken faster, and natural erectile function gradually declines. Therefore, the ideal frequency I recommend for my patients over 60 is 2 to 3 times per week. This is the golden balance, enough to stimulate testosterone production, support cardiovascular and prostate health, and preserve sexual function, while still allowing the body to recover. Once you get frequency right, the next techniques can truly show their benefits. 2. Choose the time of highest testosterone, morning. The second key to healthier, more effective masturbation after 60 is choosing the right time. And the golden window for men is not late at night before bed, but in the morning. Multiple medical studies show that testosterone, the hormone that drives libido and erectile function, peaks between 6:00 and 9:00 a.m. After deep sleep, the body has recovered, blood pressure is steadier, and blood flows more strongly to the pelvis. Therefore, morning masturbation helps the penis achieve a more natural, sustained erection and delivers greater satisfaction than at other times of day. By contrast, many men masturbate right after dinner or before sleep. At that time, blood is prioritized for digestion, the stomach is active, and the body is often tired. As a result, orgasm is harder to reach, erection time is shorter, and satisfaction drops. Choosing morning has another crucial benefit. It synchronizes your circadian rhythm. When testosterone is activated at its natural time, the body releases more endorphins and dopamine, helping you feel alert, reduce stress, and start the day with positive energy. It's a natural alternative to coffee or supplements, entirely based on your innate biology. So if you're over 60 and want to maximize the benefits of masturbation, change the habit. Choose the morning. When male hormones are at their peak, blood flow is strongest, and your mind is most relaxed. This is the golden window to turn masturbation from a habit into a method to boost testosterone and improve sexual health naturally. 3. Focus on quality, not speed. Change your approach. Focus on quality instead of speed. When younger, many men tended to masturbate quickly and forcefully just to release immediate desire. But after age 60, the body has changed. Testosterone levels are lower, nerve sensitivity is reduced, and blood circulation is slower. If you continue with the same rushed habits, not only will you struggle to reach a full orgasm, but the penis can also become overly sensitive, leading to premature ejaculation or even reduced ability to achieve a natural erection. What science recommends is practicing techniques that enhance experience and improve long-term sexual health. One effective method is the start-stop technique. Begin stimulation, and just as you feel close to climax, stop for about 30 to 60 seconds before resuming. This helps train ejaculatory control, increases blood flow to the penis, prolongs erection time, and creates a more powerful orgasm. According to a study in the Journal of Sexual Medicine, men over 60 who regularly practiced the start-stop technique were able to extend intercourse duration by an average of 2 to 3 minutes compared with their old habits, while significantly improving confidence and orgasm quality. The important point is to treat masturbation as a way to exercise and support male sexual health, not as a race against time. By slowing down, enjoying each moment, and focusing on quality, you not only improve satisfaction, but also help the body naturally maintain testosterone, support healthy blood circulation, and strengthen overall sexual function. 4. Posture and joint support. When younger, you might have been able to masturbate in any position without discomfort. But after age 60, the body changes. Knees, hips, and wrists often develop arthritis. Pelvic floor muscle endurance declines, and cardiovascular stability is not as strong as before. If you continue with awkward or prolonged standing positions, this can increase pressure on the joints, making you fatigued quickly, uncomfortable, and even affecting your erection quality. A 2020 study in the Aging Male Journal showed that men over 60 who chose to sit in a chair with back support or lie on their side comfortably were able to extend erection duration by 15 to 20%, compared with standing or sitting without support. These positions reduce strain on the heart, lower blood pressure temporarily, and help maintain stable blood flow to the pelvic area. You should also pay attention to your hands and wrists. If you have arthritis, use a cushion or soft pillow for support to reduce pain and maintain comfort throughout the process. Many of my patients have reported that simply changing position and adding a pillow significantly improved their experience, eliminating soreness and allowing them to focus more fully on orgasm. The key reminder is this: masturbation after 60 is not just about release, but also about training the body. By choosing the right posture, supporting the joints properly, and ensuring comfort, you can prolong erection time, reduce strain on the body, and turn masturbation into a safe, natural method for maintaining male sexual health. 5. Pelvic floor exercises, Kegel for men, to practice healthier and more effective masturbation. After 60, you should strengthen your pelvic floor muscles, also known as Kegel exercises for men. This group of muscles, located at the base of the pelvis, plays a vital role in controlling ejaculation, maintaining erection firmness, and supporting blood flow to the penis. After age 60, pelvic floor strength decreases by 2 to 3% each year, and without training, you are more likely to experience premature ejaculation, urinary leakage, and weak erections. The good news is that Kegel is a simple yet extremely effective exercise. You just need to contract the muscles you would use to stop urination, hold for 5 seconds, then relax. Repeat this movement 10 times, 2 to 3 sessions per day. The exercise can be done anywhere, sitting, walking, or even lying down. A study published in the British Journal of Urology, 2014, found that men over 60 who practiced Kegel exercises consistently for 3 months improved ejaculatory control by up to 80% and significantly increased erection hardness. Some of my patients noticed clear improvements after just 6 weeks. No longer anxious about losing control, enjoying stronger orgasms, and regaining their confidence. Kegel exercises not only make masturbation more effective, but also serve as a natural therapy that supports long-term male sexual health. This is solid proof that you can take control of your sexual function simply by training your pelvic floor muscles daily. 6. Use a biological lubricant. For healthier and safer masturbation, after 60, you should use a biological lubricant. This detail may seem small, but it greatly impacts safety and comfort during the process. After 60, declining testosterone levels reduce natural lubrication, leaving the penis drier and more prone to excessive friction. If you continue dry masturbation or use lotions, medicated oils, or even soap, you are unintentionally damaging tiny blood vessels under the skin, causing irritation, balanitis, and, over time, reducing sexual sensitivity. The safe medical solution is to use water-based or silicone-based lubricants, clinically tested and recommended for sexual health. These products reduce friction, protect the thin skin of the penis, and prolong erections because blood flow is not restricted by micro-injuries. According to a survey published in the Journal of Sexual Medicine, men over 60 who regularly used biological lubricants reported over 30% higher satisfaction levels compared to those who did not, along with a significant reduction in irritation or pain. Another important point is to avoid mineral oils, scented creams, or non-specialized products, as they can alter the skin environment, causing infections or allergies. Think of biological lubricant as a supportive medical tool that helps you maintain a safe, comfortable, and scientifically sound masturbation experience. This small preparation step delivers major benefits, especially for men over 60 who want to preserve their natural sexual health. 7. Mental relaxation, multisensory stimulation. At this age, the stress hormone cortisol often runs high, while dopamine and endorphins, the chemicals that create pleasure and feelings of happiness, decline. This makes many men feel that their orgasms are less intense than before. But you can change this simply by preparing your mind in the right way. Before you begin, take 2 to 3 minutes to breathe deeply and slowly, or practice a short meditation. A 2018 study in the Journal of Sexual Medicine showed that men over 60 who reduced cortisol before sexual activity experienced a temporary increase of 10 to 15% in testosterone, along with longer-lasting erections. This means just a few minutes of relaxation can significantly improve your experience. Beyond that, engage your senses to stimulate the brain more fully. Slow music, warm lighting, or even a pleasant scent such as lavender or sandalwood can heighten arousal and help you achieve a deeper orgasm. Several of my patients have shared that simply changing their environment and adding sound or fragrance made their orgasms more complete, less rushed, and easier to control. Remember, masturbation after 60 is not just a physical act, it is also a connection between body and mind. When you know how to relax and harness the power of multisensory stimulation, you not only improve sexual health, but also restore your confidence and quality of life. To make this even clearer, let me share the story of one of my patients, John, age 64. When he first came to my clinic, his biggest problem was premature ejaculation and difficulty maintaining erections. On average, each time lasted less than 1 minute, leaving him insecure, anxious, and even avoiding intimacy with his wife. After receiving guidance, John made 3 important changes. He adjusted his frequency to 2 or 3 times per week, trained his pelvic floor with daily Kegel exercises, and applied the start-stop technique during masturbation. In addition, he used a biological lubricant instead of continuing with dry stimulation. After just 6 weeks, the results were remarkable. His erections lasted longer, his control over ejaculation improved significantly, and most importantly, his orgasms became far more powerful and satisfying. John told me, "I feel like I'm 20 years younger. I no longer worry or avoid intimacy. I enjoy every moment and feel confident again." This story shows that masturbation after 60 is not simply about releasing tension. When done with the right techniques, it can become a natural therapy to restore testosterone, improve blood circulation, and bring a higher quality of life for older men. Now, let me share with you a specific plan. The 21-day recovery program for restoring natural sexual health in men over 60. This is not a quick tip, but a proven scientific strategy. In the first week, focus on adjusting the frequency of masturbation to the ideal level 2 to 3 times per week, and choose the morning, when testosterone levels are at their peak. This sets the foundation for stabilizing hormones and improving blood circulation. In the second week, add the start-stop technique to train ejaculatory control, while also beginning Kegel exercises to strengthen the pelvic floor muscles every day. With consistent practice, within just a few days, you will feel the difference in erection firmness and control. By the third week, it's time to upgrade the experience by incorporating biological lubricants, choosing comfortable postures that protect the joints, and adding mental relaxation. Play slow music, practice deep breathing, or introduce a pleasant scent to reduce stress and enhance the intensity of orgasm. After completing the full 21 days, your body will have built new habits. Testosterone will be more stable, pelvic blood flow will improve, pelvic floor muscles will be stronger, and most importantly, your erections and confidence will be naturally restored. This is clear proof that when done correctly, masturbation after 60 can become a comprehensive therapy for maintaining long-term male sexual health. We have now explored 7 healthy and science-based techniques for men over 60. Adjusting frequency, choosing the time of peak testosterone, focusing on quality instead of speed, adopting the right posture, strengthening pelvic floor muscles with Kegel, using biological lubricants, and finally, practicing mental relaxation with multisensory stimulation. Each factor may seem small, but when combined, they create a natural solution that improves testosterone, boosts blood flow, restores erectile function, and delivers a more complete orgasm. The important message I want you to remember is this: masturbation after 60 is not something to be ashamed of. On the contrary, when done properly, it can be a sustainable method of supporting sexual health, helping prevent prostate cancer, improving heart health, and maintaining lifelong male confidence. And if you follow the 21-day plan I've shared, you will feel a real transformation in your body, your mind, and your overall quality of life. Before we finish, I want to hear from you. In your opinion, which of these techniques should men over 60 apply first? Leave your answer in the comments below, because your perspective can help many men of your generation better understand how to improve their sexual health naturally. And if you found this video useful, don't forget to like, subscribe, and turn on notifications so you never miss practical, science-based health advice here on Senior Health Zone. I'm Dr. Emily Carter, and I'll see you in the next video.